What if one supplement could make your entire immune system smarter? Not stronger, in an aggressive way, smarter. That's exactly what BWH 85 beta glucan from BWH Labs does. It works with your immune system, helping it recognize threats, respond effectively, and protect you the way nature intended. BWH Labs has spent over 25 years perfecting the purest, most biologically active beta-glucan on the market, an 85% pure formula that's been tested against 200 competitors and named the most effective immune modulator in peer-reviewed research. The science speaks for itself, just one ingredient, one focus. Unmatched results. Doctors and integrative health practitioners trust BWH 85 beta-glucan, and so do I. It's available in 100 milligrams for daily support or 500 milligrams for maximum immune defense. It's only available through health practitioners, but as an intelligent medicine listener, it's available to you through my full script dispensary. Just go to drhoffman.com/BWH for more information and to order. That's drhoffman.com/BWH. Because a smarter immune system starts with one smart choice. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today's guest is going to talk to us about the brain-body connection. And there's certainly a two-way street because the body influences the brain influences the body in so many different ways. That's her specialty. She is the author of It's Not Just in Your Head, Demystifying the Brain-Body Connection in Mental Illness. And we're going to talk about problems related to the gut and how the gut affects your mood and your mood affects your gut. We're also going to talk about the relationship between various infectious diseases and your mental and cognitive functioning. And we're also going to talk about the microbiome. These are all in the wheelhouse of today's guest, who is Dr. Susan Trackman. She's a regular contributor to Psychology Today, which breaks down complex neuroscience and psychiatric concepts for the lay people. And she is ready to talk to us about a wide variety of topics related to the brain-body connection. So welcome, Dr. Trackman. It's a pleasure having you on Intelligent Medicine. Thanks very much for joining us.
Well, thank you so much for inviting me. It's a real treat.
So you are a board-certified psychiatrist, but you seem to have developed an interest in the way that the body influences the brain and the brain influences the body. I mean, so often I think in psychiatry, we tend to think of relating to psychiatric issues as just a matter of choosing the right medication and fixing whatever brain imbalance there is. But you take a kind of a more holistic approach to psychiatric and psychological issues, right?
That's true.
Indeed.
Yes.
And so
I guess what I was going to say is I think that, for countless eons, there was a sense that mental health was different than physical health. And what I like to say to my patients is, well, if I cut your head off, could you survive? Of course not, right? So to make it an arbitrary distinction between mental illness and physical illness makes absolutely no sense.
right,
Everything's connected.
And I think it harkens back to, I believe it was the Romans who said, in mens sana corpora sana, in, healthy mental
healthy
outlook.
mind, healthy body.
Healthy mind, healthy, right, exactly. So that's kind of an old aphorism. And that there's a linkage, but we seem to have forgotten that in our kind of the way that we slice and dice physical problems versus mental or psychiatric problems. And so you developed an interest. Well, how did you develop an interest in this area?
I think when I was in medical school, I was interested in too many things. I couldn't really decide what I wanted to be when I grew up, so to speak.
Mm-hmm.
And I liked the way you have to think to be a good internist, meaning you have to look at a collection of symptoms and signs and symptoms and come up with a differential diagnosis and then sort of look at what's more likely versus less likely. Um, Also really like neurology, basically those who specializes in brain disorders. And quite honestly, I think human behavior is fascinating. So what would put them all together? When I was in school, there was a subspecialty in psychiatry called consultation liaison psychiatry. And I was very much influenced by one of my attendings, who I think in the book I refer to as Dr. Kent.
Right, kind of
And
a Mick Jagger-like figure you describe
totally,
in the book.
yes. And that's kind of a very adept description of this man who had a British accent and a bushy mustache, long hair. I was in school in the late 1980s. And he used to wear his white coat with his collar, popped up. And he had these little groupies. The psychiatry residents who were on his service all seemed to be following in the way he presented himself. So they also started growing their hair and they wore their coats the same way. And by the way, everybody wore clogs.
Oh yeah, that was
Now,
the thing.
for
That was
your
the thing.
listeners who may not know what clogs are, I mean, usually people who wear clogs are either chefs or surgeons
Hmm.
because they're comfortable shoes and they're kind of ugly, but they get the job done. But no, he walked around the hospital in clogs. And
I predate that because people were
uh,
wearing earth shoes in my era.
okay.
So yeah, that takes us way back.
So I guess what I found from Dr. Kent was because he was a board certified psychiatrist and neurologist, that I saw some of the most interesting patients in the hospital. And I thought to myself that, if I was going to have a career that spanned decades, I didn't really want to be doing the same thing over and over again. My friends who went into surgery later told me that after a while, it's like, Sue, it's like laying bricks. I mean, after a while, you're just doing the same thing over and over. And to me, the incorporation of, medicine and neurology and psychiatry led me into this field, which is now called psychosomatic medicine.
Hmm.
Not to be confused with hypochondriasis.
Right.
Psychosomatic medicine, psycho from the brain, somatic from the body, means that these are real, underlying real medical symptoms and conditions that are very much influenced by what's going on in your brain and vice versa.
Right. But unfortunately, psychosomatic has the connotation that it's dismissive, is that it's all in your head. But as the title of your
Right.
book kind of reverses that, it's not just in your head, is the title of your book.
And it was named that intentionally,
Hmm.
because a lot of the folks who come to my office for consultation have been to multiple different physicians with symptoms that don't fall into a neat category. And they've been told after getting referred from one specialist to the next to the next, there's nothing wrong. We can find nothing wrong with you. It must be all in your head. Go
Right.
see a psychiatrist,
It's like it's
which is how they got
binary.
mine.
It's binary. If we can't
Yeah,
find anything, it must be psychiatric or psychological.
right. So which is how they came to my office. And so when they say, well, they've all told me that it's all in my head, my response is yes, because your brain is in your head. And if you think about your brain as a big computer that has lots of little USB ports, all the connections go to different parts of your body and they send signals in two directions. So, apt title of the book, it's not just in your head because it's not.
Indeed. You actually talk about something called MUS. What does that stand for?
One of the old terms for these disorders are called medically unexplained symptoms, which again, I think is a misnomer because they're not unexplained. You just have to take the time to think about them and where they might be coming from. And, if I can just go off a little bit on this area, medicine today has become a business. In other words, I am a unique um, species, almost like a unicorn, a solitary, psychiatrist in private practice.
Right. It's
Most
a
people are
dying
just
breed
not in
because
private.
now it's like
Exactly.
this corporate medicine is buying up practices, and it's all group
Yeah.
practices or hospital-based
Yes.
practices, and independent
Right.
practitioners are basically going extinct.
You are totally correct, and you've summarized it beautifully. And I guess the point that I was going to make, just taking off from what you just said, is much of medicine has now been sort of subsumed under, hospital based medicine, meaning hospitals buy up smaller practices, or venture capital devise
Yep.
up these practices. And the result of that is the people who work in those practices have to meet certain numbers. It's almost like a salesperson who has to meet numbers in order to get their bonus. So that translates to, in your average primary care setting, the average time for a primary care visit is between 15 and 17 minutes.
Right. It's all about productivity, kind of a high throughput
Yes,
operation. And oh, by the way, if you're a psychiatrist, you don't have the procedures that enrich other doctors. Like a gastroenterologist can line people up for endoscopies or
right,
colonoscopies, and a cardiologist can line people up for stents and various
right,
procedures. Right.
right. Yeah. And so if you think about that from a patient's point of view, you have this potentially complex set of symptoms that don't fall neatly into any category. You've got 15 to 17 minutes to explain them to someone you've never met before. And in that time, they need to cut to the chase and try to find out what's wrong with you so that they can order the appropriate tests or scans or whatever. And you can see why the outcome might be. We can't find anything. We've reviewed the labs, we've reviewed the scans. There's nothing that stands out. There's nothing wrong with you. Go see a psychiatrist. I fortunately still have the luxury, since I'm in my own practice, of scheduling an hour to see a new patient, and I in advance look at all the information that's available to me so that when someone comes in with a complex history, I mostly have already reviewed it, and I can discuss what other possibilities might be going on that others didn't have the time to look into that might be contributing to the ongoing symptoms.
So actually, this enables you to look at potential root causes, because someone who manifests with symptoms that look for all the world like depression may be suffering from an iron deficiency anemia or a megaloblastic B12 deficiency anemia that's affecting their brain, or they may have celiac disease, for example. There's a lot of
Yes.
potential connections.
Everything you said is true. And I'll just give you a sort of an example that stands out in my mind if I can. I had gotten a call a couple of years ago from a man who said that he was in his 70s, and he goes, again, he's from New York. I'm from New York, but he was from New York, kind of a gruff guy. And he's like, I don't know if you can do anything to help me. I'm just not functioning. I might as well be dead. I just don't know what's wrong. I mean, you probably don't even want to see me. And I'm like, just come in.
A lot of negativity.
So he walks through the door, and as soon as he walked from the waiting room to my office, I knew exactly what the diagnosis was before he even sat down.
Wow.
And you're a physician too, so I bet you're going to know this when I tell you. So he had a wide base gait,
Hmm.
classic wide base gait. He came into my office, he sat down, he told me some of the symptoms he was having. He said, I'm so depressed, I just can't function. I can't think like I used to. Oh, also now I have to wear Depends because I'm having urinary problems. Classic triad, right? Cognitive impairment, urinary incontinence, wide base gait, hydrocephalus,
Oh my
normal pressure
goodness. Yeah, there you go.
hydrocephalus.
Yeah. Uh-huh.
So,
It's
no,
ataxia,
he
right?
wasn't,
Yeah.
he wasn't, he wasn't demented. I mean, he was depressed because he was having these symptoms,
Hmm.
but when I explained to him what I thought it was and referred him to a neurosurgeon, and then he had a shunt, and he came in
Hmm.
a month later,
By
clear
the way,
as
that's
a
the
bell.
Billy Joel disease. You can't blow the
Oh, is that
cover
what
of
they
your patients.
decided he has?
Yeah,
Uh-huh.
that he
Uh-huh.
has a normal pressure hydrocephalus from which he seems to be recovering, but it actually, he had to stop performing as a result of it.
Yeah.
Yeah.
Yeah. I mean, it makes a huge change in your life, but most physicians are not going to naturally think about that because that's not what you see on a day-to-day basis in a practice. When I was in school, and I don't know if they said the same thing when you were in school, but when you hear hoofbeats, think horses, not zebras. And, it's in my mind, this was not exactly a zebra because it's not that far-fetched.
Yeah.
But it's not going to be the first thing you think about. You have an elderly man, who is depressed and has all the symptoms of depression and is now having urinary incontinence and is getting a little bit cognitively impaired. You're like, oh, okay, natural part of aging,
Yeah.
whatever.
Prostate
Which would be a
problems.
real shame, right?
Yeah.
That would be like a real disaster. P.S., like I said, he had a shunt. It was successful, and he still wasn't the happiest person on the face of the earth, so we treat it as depression, but at least he was thinking clearly and no longer had urinary incontinence. So that was good.
Indeed. Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Please listen up. Magnesium is crucial for over 300 processes in your body, from energy production and muscle recovery to sleep quality and stress response. Yet most Americans don't get enough. In fact, in a peer-reviewed clinical trial published in the Journal of the American College of Nutrition, more than 75% of participants showed suboptimal magnesium levels before the study even began. Those who took Jigsaw Mag SRT, a time-release magnesium malate tablet, saw magnesium rise 30% over 90 days, and deficiency symptoms dropped by 63%. Remarkable results backed by real science. And for sleep and recovery, Jigsaw Mag Soothes delivers. In a 4-week clinical trial tracked with Oura Ring data, participants saw a 17% improvement in sleep quality, felt 34% less stressed, and rated their satisfaction 85 out of 100. 82% said they'd buy it again. 2 supplements, 2 clinical trials, 1 company that does the research. Jigsaw Health. Mag SRT for daily magnesium replenishment. Mag Soothe for calm, restorative sleep. To order, go to jigsawhealth.com. That's jigsawhealth.com. Use coupon code Hoffman15 for 15% off your order. That's jigsawhealth.com, code Hoffman15.
Are you ready to experience the future of digestive wellness with Dr. Ohhira's new and revolutionary postbiotic fermented food concentrate? Capsule-free and in individual sachet packets that harness the power of 5 years of fermentation and over 500 concentrated bioactive postbiotics. Dr. Ohhira's postbiotic fermented food concentrate is a nutrient-dense paste designed to supercharge your digestive health, aid in nutrient absorption, and support whole-body immune wellness. Each sachet packet delivers a potent blend of fermented paste and prebiotics which serve as fuel for your body's own unique gut microbiome. This concentrate supports your entire digestive tract, does not need refrigeration, non-GMO, dairy, and gluten-free. Dr. Ohhira's postbiotic fermented food concentrate. It is the ultimate embodiment of traditional Japanese fermented craftsmanship, designed for those who seek the highest concentration of nature's restorative power in every serving. Ask your natural products retailer for it today or online at essentialformulas.com.
Thanks for listening, and thanks for supporting our sponsors. They are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Susan Trackman, author of It's Not Just in Your Head. So let's talk a little bit about new findings about the gut-brain connection. And I think this is only coming into prominence over the last decade or so. And again, ancient wisdom, because it was in the 19th century that we developed the theory of auto-intoxication, that bad stuff happening in your gut could enter your bloodstream, can enter your brain, can cause you to be gloomy. That actually goes back, it's an ancient theory.
Right. I mean, remember the Hippocrates, I think, was, what is it, the 4 humors,
The
black
humors,
bile, yellow bile,
exactly.
blood, and phlegm, all disgusting. But yeah, I mean, this is not a new theory, but you're right. I mean, there's been so much written about it, and I think you yourself have published some books, right, in this area that, for your listeners' sake, and maybe they already know this from listening to you, but, your brain and your gut are actually derived from the same embryonic material. So, when you were still like a bundle of cells before everything differentiated into, organ systems, some of those cells migrated north to become your brain and your spinal cord, and some of them migrated south to live inside your digestive tract, and that was called your enteric nervous system, or your second brain. And they communicate.
Which actually, I'm told it has perhaps potentially more neurons than in your brain. There's
Yes.
billions and billions of neurons within your GI tract.
That's true. And there are also more serotonin receptors, serotonin being one of the major neurotransmitters or brain chemicals. There are more receptors for those in the digestive tract than even in the brain. So your gut is very, very important in terms of treating all illness. But in my area of expertise, any kind of psychiatric illness, we always want to look at that as a possibility.
And so, okay, let's posit that there is a disruption to the microbiome, and we can detect that potentially through stool tests, or we can sometimes have a presumptive diagnosis. You're eating a crappy diet and we want to clean up your act. What are some of the
Right.
ways that you can optimize your microbiome that can
Right.
have an impact on your mood? There are even what are now called psychobiotics, probiotics
Yeah.
that, lift your gloom.
Well, I think, yeah. Yeah. So
That may be a
again,
bridge too far, but
no,
we're
no, no, not at all. So for your listeners' sake, if you think about the gut as a garden, and the term for the environment within your gut is called the microbiome. And within the microbiome, if you think of it as a garden, as with growing any kind of garden, things grow better if you have diversity, right? So if you grow different kinds of plants, they're going to hopefully allow each other to thrive. Within your microbiome, there are what we call the good bacteria and the bad bacteria. And just because I say bad bacteria, it doesn't mean you shouldn't have them. You should have them. But what you want to do is have them in balance. Sometimes what happens if they get out of balance, and some of the common ways, very common ways that might happen, number one would be taking an antibiotic because you're sick and your doctor prescribes an antibiotic. That knocks out the good guys as well as the bad guys. So what can happen is the amount of the bad guys overrides that of the good guys. And the result of that is inflammation. And you may have already talked with your guests or your listeners about inflammation and the effect that that has on your whole body, but including your mood. There's a term that's called leaky gut, which you may have discussed in previous episodes.
yes.
But for your listeners' sake, I would just want you to think about the outer part of your gut. And this is very simplistic. If you think about the outer part of your gut as lined with little bricks, like you would have bricks in a garden. And you really want to have those bricks kind of tight together to keep all the stuff inside. And those are called tight junctions. What happens when things get inflamed is that those junctions, they separate, they get wide. So things can leach literally from the gut out into the bloodstream and travel to different organ systems and cause um, symptoms. So they can travel to your joints and cause joint pain. They can travel to your brain and cause depression because these are not really fun things. It's causing inflammation in your brain. So they can cause all kinds of symptoms. And the way to improve that, one is what you said would be number one, to take a probiotic, which kind of rewires your gut with healthy bacteria, or eating what we call, an anti-inflammatory diet. So what does that mean? Anti-inflammatory diet are things that will decrease inflammation naturally and will increase the population of the good bacteria in your gut. Common things are common, right? You can eat yogurt. Greek yogurt has a lot of protein. Great. You can take a probiotic. Great. You can eat fermented foods if you so choose. Personally, I like kimchi. Some people don't, but other fermented foods also really good. Shellfish is very, very good as an anti-inflammatory diet. Naturally, if you think about people who live in the Mediterranean areas, they have some of the longest lifespans of anyone on Earth. And one of the things that they have in common is they eat things that are common to that area, which is why it's called sort of a Mediterranean type diet. It's not a diet per se, but it's that you choose your food choices from things like lean meats, seafood, chicken, turkey, lots of fruits and vegetables, whole grains, nothing processed. Um, you want to limit your alcohol because some people don't know that alcohol is actually an inflammatory substance.
And
Listen,
may
everybody likes,
disrupt the gut-brain barrier and allow
yes,
leaky gut. Yeah, because it
correct. Listen, I like a steak every once in a while, but it's not good to eat on a regular basis because red meat is a pro-inflammatory substance. You know, a lot of people like bacon and like to cook with bacon. And you know what? Every once in a while, it's fine to have it. But a regular diet of something like bacon, which is a processed food, is a pro-inflammatory food. So again, one does not have to dramatically change the way they function and eat, but you can choose to make your choices. You can make your food choices from substances that are more likely to repopulate your gut with healthy bacteria and decrease the inflammation, not just in your gut, but in your entire body.
I'll give you an example from my own personal experience with a
Uh-huh.
patient who was actually one of those mystery patients. She was
Yeah.
actually a high functioning executive who was running a very, very busy nonprofit. And she suddenly became sick and she had to step down from her position. And I talked to her about what she was doing, and she said she tried a million different things, and yet she was exhausted, and she had gastrointestinal problems, and she had brain fog, and serious mood problems, anxiety,
Right.
depression, and so I lost track of her, and then I saw her at a conference, and she was perky and she was energetic, and I said, "What
Yeah.
happened?" She said, "Well, I went back to
Yeah.
work. I think I found the answer." And I said, "What was the answer?" She says, "Well, I just was looking wherever I could. My last resort was I found a place in England. You had to go outside the country to get this fecal transplant.
Yes.
In other words, so she had a fecal transplant, and she said,
Mhm.
I must have gotten a transplant from a happy person because not
Right.
only are my physical symptoms alleviated,
Yep.
but my mood is so much improved."
Yep.
And she was radiant. Yeah, she was
Yep.
radiant. It
Yep.
really changed her whole physiognomy and
Yes.
physiology. It was very profound, really an illustration of what the gut can do in
Yes.
terms of influencing the body.
Yeah, and I think I have a section about this in my book. And your listeners might hear us talking about fecal implants, and they're like, "Ooh, that's disgusting." No, it's not what you think. Um, they actually do take waste product the way this is manufactured. They do take the waste products from healthy individuals, and they create it's like a little concentrated pill that you can take, and that's the way it's taken. But it started off with animal studies, as it often does, in terms of taking transplants from what they called healthy animals, those who seem to be
The
perky and were
donor
eating.
it's very important to
Yeah,
screen the donors to have,
yeah,
because not everybody has the right balance. You can't
that's
do it
right.
casually. Yeah.
No, but it is true, and it absolutely works. So again, further evidence, as you said, of how important the gut is in terms of regulating so many physical components of our bodies as well as our mood, and also the fact that the gut is a major component of our immune system. So if your gut is not healthy, it's going to take a toll on your immune system overall.
Another illustration of the connection is recently
Mm.
I interviewed a pioneer in the field of VNS, vagal nerve
Hmm.
stimulation. And what
Hmm.
they do is they apply a small electrical current to your vagal nerve, which is the
Right.
two-lane highway or
Yeah.
maybe eight-lane highway that goes
Yeah.
from your gut to your brain and your brain to your gut
Right.
and all your organs. And you apply a small electrical current for 1 minute per day.
Yeah.
And they've now gotten approval for a very challenging inflammatory disorder, which is rheumatoid arthritis.
Yeah.
But they also are working on ulcerative colitis and
Yeah.
Crohn's disease
Yeah.
because the vagal nerve has so much of an influence on how our body functions, and vice versa. You have a disrupted GI tract, it's going to send signals to your brain.
Right. Right. Yeah. And I think I reviewed some of the vagus nerve studies in my book about when scientists actually, and again, this is volunteers who were in a study, when they stimulated the vagus nerve at different frequencies, the participants would report either being anxious or depressed or happy, depending upon the
Right.
frequency.
They got to get the frequency and
Yeah.
intensity right. It's just very,
Right.
very dialed in kind of therapy.
Yes. I don't think it's considered mainstream right now. It's probably still in the
Approved for
experimental
rheumatoid
stage.
arthritis. Now
Oh,
approved.
has it? I should
Yeah.
tell my daughter. She's a rheumatologist, so she
Yeah.
probably would look into that.
Yeah. Good stuff. All right. Well, we've laid down the groundwork for a discussion part two. I want to talk a little bit more about the role of stress. I want to talk about some techniques that people can utilize to address the stress that may affect their pain levels and their moods. and some of the other ways that the brain-body connection may have a serious impact on our health and could be the underlying cause of many disorders. I'm Dr. Ronald Hoffman. Our guest today, Dr. Susan Trackman. She's author of a great new book entitled It's Not Just in Your Head, Demystifying the Brain-Body Connection in Medical Illness. This is the Intelligent Medicine Podcast.